Hello, my name is Dr. Andy Muchmore and I'm the CEO of Codonics, and I would like to discuss the value of a Common Clinical User Interface, or CCUI, to simplify data extraction. As the co-inventor in 1995 of medical software currently used to document more than 1 million charts a year, I'm constantly looking for advances in the field. Google Health, in partnership with Ascension Health, has developed a game-changing analytic tool, Care Studio, which solves data sharing not by trying to update and synchronize multiple different sources of data, or by sending medical information from master patient record, but by extracting the information from multiple EHRs and displaying the information in an easily searched format. By design, the data is always current and complete. What are the limitations of this approach? The major limiting factor for Care Studio is its reliance on data that resides within a particular clinic, hospital, or enterprise system. Although very valuable, this perpetuates the silo problem, where different enterprise systems struggle to share data. One solution is to convince vendors to store their clinical data in Google's cloud. I suspect that getting large enterprise systems to voluntarily upload to Google Cloud will not be easy, and Epic has already announced that they will not support Google Cloud. Short of mandating storage in a common cloud environment, are there other pathways for Care Studio? A complementary approach would be to standardize the user interface across multiple systems, providing a common clinical user interface. This would make it much easier for clinicians to document using different EHRs at different hospitals or clinics. For those who remember the advent of word processing, there are some striking parallels. In the beginning, there were at least 20 different word processing applications. None were compatible with each other, and most had a fairly steep learning curve. Professional users like administrative assistants were stuck with whatever system was being used and would have to learn a whole new system if they changed employment. This balkanization made no economic or practical sense, and users rapidly coalesced around at first two and ultimately a single data entry tool, MS Word. Ultimately, clinical content will be entered using a single, robust data entry tool, but it will have to be developed from the outside. One need only ask the hypothetical: will Epic abandon their clinical content user interface to embrace that used by Cerner? In today's rapidly changing clinical environment, any common clinical user interface must be supported by a robust, powerful, and intuitive development environment to allow clinicians the ability to constantly add new workflows. Ease of new content development is the most important aspect of any proposed common clinical user interface. This already exists, and in the next blog, we will outline key features for a proposed common clinical user interface tool. Thank you.